Welcome, everyone. It is the 10 o'clock hour. Today is Tuesday, March 24th, 2020. The Board of Supervisors of the County of Del Norte and the governing body of all other special assessment and taxing districts for which said board so acts is now meeting in regular session. Only those items that indicate a specific time will be heard at the assigned time. All other items may be taken out of sequence to accommodate the public and staff availability. Kylie, would you please take roll?
Supervisor Howard?
Here.
Supervisor Cowan?
Here.
Supervisor Gitlin?
Here.
Supervisor Berkowitz?
Here.
Chair Hemmingson?
Here. And we will take a moment of reflection. Now, if you'll all please stand, Vice Chair Cowan, will you please lead us in the Pledge of Allegiance?
Yes. Ready? Begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, introduction of new employees. I don't know how we go about doing that. I don't see anybody raise their hand. I don't see any of that. County Council, any actions from closed session? No reportable actions. Thank you. At this time, I would request any deletions, corrections, or additions from board members. In order to add an item to the agenda, the matter must have come to the attention of the county subsequent to the posting of the agenda, and the matter requires action before the next regular meeting of the Board of Supervisors. Are there any such items? Okay, seeing none, we will move on to brief reports and announcements relative to the County of Del Norte. Supervisor Howard, would you please start us off?
Thank you, Chairman. It was a busy week specific to lots of questions by the public, but I'll try to keep my briefing, at least today, to those commissions and meetings that were specific to our board and our activities. Met with the First Five Family Commission and had some discussions on our directors' salaries and how to move forward with some issues that we've been having there for the past couple of weeks. But in addition, talked a great deal about the Dolly Parton reading program that we brought now into our community in conjunction with the Wonder Bus, which is back on the street through the Del Norte Child Care Council, and literacy is still alive and well in our community and needing to move forward. My hopes is in a lot of the programs that are going on here today in our community through First Five, that someday when all this craziness is over, we could have Angela Galore in front of the board to give some public comment about all these wonderful things that are taking place. Had a Solid Waste Management Authority pre-meeting with Ted Ward on some SB 1383 legislation and issues around SB 1383, but in addition also had a Solid Waste Management Authority meeting to discuss those issues. In addition, had a lot of discussion with CDC around the Saxton's boat launch area in Smith River, and also some private property concerns around that, specifically around wells. Had communication with National Parks, Steve Mers on the Hyuchi Trail System, and then also a North Coast Air Quality Management District meeting, and also attended the Board of Supervisors emergency meeting. That's all I have to report at this time.
Thank you. Supervisor Berkowitz.
Thank you, Mr. Chairman. Before the shelter-in-place order due to the coronavirus, Supervisor Gitlin and I had a town hall meeting with the residents of the Hunter Creek subdivision. They wanted to be informed about the plans for the Yurok tribe to take over the playground so that they could install playground equipment. After much discussion, the consensus was that they would rather set up a 501c3 so that they could control the playground. They asked that this action be postponed until they could form a nonprofit entity and present their plan before the board. The day before, the all inside service to restaurants was to be eliminated by the order of the governor due to the coronavirus. Many of the owners of local restaurants met with me at the Fisherman Restaurant during the daily town hall meeting. They were hoping for some wiggle room in the governor's order so that the restaurants could stay open and continue to serve customers with inside seating. I explained the governor's order and that if they stayed open, they would have to have takeout or delivery service. I also received many phone calls from individuals asking what the limits are to the order to shelter in place. And that's my report, Mr. Chairman.
Thank you. Supervisor Gitlin.
Thank you, Mr. Chairman. Well, the COVID-19 virus continues to dominate our news and alter our behavior. Delaware County remains free of the reported virus, while the state has released the latest numbers, and these are fluid numbers and increasing. As we speak now, there are 2,100 COVID-19 cases and 43 deaths associated with the virus up and down California. Nationally, there are approximately 48,000, of which 25,000 are in New York cases of the COVID-19 virus, resulting in 588 deaths. And again, these are fluid numbers. Around the globe, there are 400,000 cases, resulting in 17,000 plus deaths. But more importantly, there are 104,000 recoveries. So we hopefully will see a turn in this. We've received some calls and email regarding community concern about area visitors coming to Delaware County during the secured emergency lockdown protocol issued by the state. As one would expect, there's a mixed message here. County cannot prevent people from traveling, but I would share with you all and ask the question, is the cure for COVID-19 worse than the COVID-19 itself? If non-essential businesses are closed down and folks are laid off, I suggest that these cures may in fact be killing the patient. A governor's executive orders can close a so-called non-essential business, but how does that business and its laid-off employees return to economic viability? I know this is a very painful subject and one which is not a clear black and white issue, but we must all address how we can survive after the virus is contained. Our board members were contacted from the SEIU recently requesting a letter of concern be sent to the State Department of Health and Human Services implementing certain protocols for IHHS providers during the COVID-19 crisis. I'm pleased to say that the state is addressing those issues as we speak. And again, as Supervisor Berkowitz mentioned, he and I met with residents in Hunter Valley last week to discuss the transfer of the Hunter Valley Park to the Yurok tribe. Obviously, there was a very strong pushback, and the community is organizing as we are meeting now to discuss the county-owned park's future. And the Hunter Valley residents will be putting a proposal in front of this board in the immediate future. And that is my report.
Yes, Vice Chair Cowan.
Thank you, Chairman. After this meeting, we had a Solid Waste Authority meeting talking about safety of the safety measures that need to be put in place, the employees, and possibly what changes might be made if necessary out at the transfer station. Had a meeting with Heather Snow, Daphne Lambert, and Tamara Layton to discuss funding around Del Norte Mission Possibles, showers for the homeless, and housing for elderly homeless at this time that we have out on the streets to make sure everybody's taken care of. Had a follow-up with Daphne out at the shelter as well, just what they're doing in place to make sure that the homeless are not roaming and are being taken care of as well. Conversation with CSAC over the weekend around the real estate industry. They neither were on the essential or non-essential list, which was a little bit disconcerting. So talking about how that's going to go. I know there's lists out there, and as we're told, they're fluid and they're changing, and every day is different. So be aware of what is essential and what is non-essential out in our community, so that we can take care of our community members. Spoke with public health nurses, went out there with Heather Snow last week, had conversations with DHHS and the senior center around the mobile showers that we've been working on for the last year, and hoping that they get done and taken care of right away to help us with what's going on. Attended the Board of Supervisors special session on Friday, and I also have had many, many calls and emails regarding the COVID-19 issue and what's going on in our community and what we're doing here to take care of our own, and making sure that all safety measures are in place. And that's it for me.
Thank you. Well, after the board meeting last week, I went to RCRC, which is representing California Rural Counties. We had quite a few updates on the homeowners insurance market, forest management and wildlife update, homeless budget proposal update. We also had a presentation on from GoBiz on Assembly Bill 1236, which is the has to do with electric vehicle charging compliance and streamlining the process for permitting. So that was pretty interesting. While I was in Sacramento, they were having the 47th annual Zeke Greater Fisheries Forum, so I stayed for that, and also the ESJPA meeting, which is the Environmental Services JPA, and almost all the discussion was around SB 1383 having to do with the organic waste. And so they had the model tools presentation, pretty extensive program. But then went to the Fisheries Forum reception, which I got a chance to meet one-on-one with Secretary Wade Crowfoot from the Resources Division, California. He expressed interest in coming up to Del Norte County and fishing on the Smith River, so looking forward to that. Also talked with Zonky Mastrip from the Department of Fish and Wildlife, Senator McGuire, and his aide Tom Weslow. And then I went to the Joint Committee on Fisheries and Aquaculture, where Chuck Bonham from Department, who's the Director of Department of Fish and Wildlife, as well as Secretary Crowfoot, both gave presentations. Had a conference call with from the CSAC Coastal Counties co-chairs, which I'm one, Supervisor Alejo and Supervisor Gibson and myself, around funding for sea level rise issues. So we had a short conversation about the direction we were going to go there, and we were going to get together to follow up with that. Had agenda review, had a NCRP meeting, a regional forest and fire capacity ad hoc committee meeting, continuing on with our priorities about that, and seeing what we can do to keep that going and to get funding for that. Participated in a webinar with California Department of Fish and Wildlife, going through their ITP process, which is an incidental take permit for the Dungeness crab industry. Came down and did a little test run for our internet connections for our board meetings, and then we had a special meeting of the Board of Supervisors that I participated on. Did a Facebook live press statement with Mayor Inscore and myself, and then yesterday we did a multi-agency press release that included agencies throughout Del Norte County, Department of, or our fire, or not our fire, excuse me, the sheriff, and chief of police, schools, public health, Mayor Inscore, myself, Jay Serena, Eric Weir, Anyway, a little presentation that you can find on I think it's on YouTube. Excuse me, I had a little slick spot in my brain there. Also, I'd like to report that we've got water out to the lighthouse now. That finally got installed thanks to Northridge Electric. We got that all taken care of. And I would remind everyone, the reason that we're having meetings the way we're having them now is because we should all be sheltering in place if we can and social distancing. Hopefully everybody is practicing those things. And we are going to, with that, that's my reports. Now we're going to move on to the consent agenda. And I would entertain a motion.
I make a motion to approve consent agenda items 1 through 6.
Second.
I have a motion and a second. Is there any public comment on the consent agenda items only? And just to remind you, for those participating in this meeting via Zoom, please remember to click the raise hand button if you would like to speak when comments are open to the public. Are there any comments on consent agenda items only? Okay, seeing no public comment, Kylie, would you please poll the vote?
Supervisor Gitlin?
Yes.
Supervisor Howard?
Yes.
Supervisor Berkowitz?
Yes.
Supervisor Cowan?
Yes.
Chair Hemmingson?
Yes. And within that consent agenda, we approved a proclamation concerning National Vietnam War Veterans Day, March 29th, 2020. Whereas the Del Norte County Board of Supervisors are patriots, loyal to the Constitution of the United States, and supporters of the United States military and of those veterans who have served to preserve freedom for the great nation, for this great nation, and whereas in recognition of the commitment and sacrifice of the military troops of the United States of America who served at home and abroad during the Vietnam War conflict era, and whereas in care and concern for over 2,700,000 troops who served during the Vietnam War conflict era, and many of those who returned home to unkind treatment, and whereas due to that concern and lesser treatment of our military who served during the Vietnam War, a law for remembrance, honor, and care was passed as the Vietnam War Veterans Recognition Act of 2017. And whereas the Vietnam War Veterans Recognition Act of 2017 was signed into law by President Donald Trump, declaring the National Vietnam War Veterans Day as March 29th in perpetuity. Now therefore be it resolved, the Del Norte County Board of Supervisors proclaim the National Vietnam War Veterans Day, March 29th, 2020, as a day to fly the flag, a day to honor Vietnam veterans, and a day of thanks and remembrance for those men and women who put their lives on the line for freedom, and especially for the 13 young Del Norte County men who died on the battlefields of Vietnam, approved and adopted this 24th day of March 2020 by unanimous vote. Okay, thank you. We're going to move on to our general government items. We're going to move on to item number 10, which is to approve and adopt an ordinance adopting the state model water efficiency landscape ordinance, and to designate county council to prepare a summary of the ordinance for publication as requested by the Director of Community Development and County Council. Council, are you going to speak on that, or is anybody going to speak on that? Okay. Hi, Heidi.
Good morning. Did you want a summary, or did you just want me to respond to any questions that you may have?
Maybe a quick summary. I think we've been kind of going over this. If you could just maybe bring us up to speed for a minute, and then field any questions.
Sure, sure thing. Back in the 2009-ish, the state legislature adopted a state model water efficient landscape ordinance, which required some permitting requirements if you were to install landscaping at your home that required irrigation systems, and that would be as part of some type of a development application that you were pursuing with a local jurisdiction. At that time, they gave jurisdictions choice of just following the state law or also incorporating it into their own ordinance. Our Board of Supervisors at that time decided that we would just follow the state law, which is what we have been doing. At this time, in order to be more transparent with the public, we feel it would be beneficial to actually incorporate it into our code, to place more things on our county website to let the public be aware of what requirements that they may have. I would just like to say that to date, the development applications that we have received through our office generally have not been subject to this ordinance because it's not very frequent in which homeowners install irrigation systems as part of their development application. So from our standpoint, this is just placing it into the code. We're already doing it. It's state law. We have to follow it. But I'm here if you have any questions.
Thank you. Any questions for Heidi from board members? Supervisor Gitlin.
Yes, thank you, Heidi. Are you there? Let's see, look at a picture for you. Okay, you're here. You know, Heidi, since we had this discussion prior to today's meeting, where we had the initial reading of waived the reading, I've done a little research, and I'm still a little confused about why the necessity of having a duplicative ordinance when there is one in state. But I'm also understanding that after talking to some people, Mr. Franklin Saylor, who is the chief engineer of the State Water Control Board, that this has another meaning, this local ordinance, because back in 2016, Supervisor Hemmingson, as the chair, joined several other counties in making our case to the state, and the state essentially agreed to put hands off on this thing. Now we're coming back with a local ordinance, which most certainly would be enforced, and there are a number of agencies, including Big Rock, who are opposing this. So if we do not do a local ordinance, which seems kind of crazy with a community that has over 80 to 100 inches of precipitation each year. This was done during 2016, during the drought period. What are the consequences if we simply just let the status quo exist? What would be the problem by just having state law? And then, of course, at CDD across the desk, you can explain what the confusion may be. What would be the problem in doing something like that? Are you there, Heidi?
No, I think we lost her.
Okay. Okay.
Maybe council could answer the question. You good with that, Heidi? We can't hear you. I can see her talking, but I can't hear her.
I don't read lips.
I hear you knocking, but you can't come in. No, you can't come in. I can't hear you knocking. Would you? Can you hear us, Heidi? Give us a thumbs up, thumbs down.
The mic's off.
Anybody, any panelists out there, can you push your raise hand button if you can hear us? Oh, there, we got attendees, but no panelists. I don't see any panelists. Raising any hands?
Is Heidi coming down? Because I see an empty.
Yeah, why don't you come down to the podium, Heidi? I guess the participants can still hear us, I guess, since we got some raised hands, so go ahead, Heidi. Sorry about that.
Oh, I don't know where I was now. I'm sorry.
I think the question.
Oh my gosh,
The
okay.
question
Did you
from
hear my question,
Supervisor
Okay,
Gitlin
okay.
is why the
I mean,
duplicitous.
It's state law. We have to follow it.
Right.
Whether or not it's in our code or not, it doesn't matter. We still have to follow it. I think for the benefit of the public and for our office, it's helpful to have it in the code because we can point to it. And when people ask us if we have adopted this code, we can clearly state we have, and it's not nebulous. So, I mean, I think it helps us from a staff perspective when other agencies or interested parties are trying to determine whether or not the county is a participant or actively following state law.
So, as was mentioned, Big Rock Water is opposed to it. Why would they be opposed to something that they have to adhere to anyway? That's, I guess that would be my
I think I
question.
can address that in having a conversation with one of the individuals from Big Rock, is the law simply has not been enforced up here. It's been, again, through the works of our county and 8 other counties who went down in 2016 to plead this case, the state has left us alone. So now if we implement a local ordinance, it will most certainly be adhered to. Now, this is what I'm hearing from Big Rock, and this is what I'm hearing from Mr. Franklin Saylor, who is the chief engineer from the State Water Control District. So I'm just wondering what the necessity of the omission of having a local ordinance, other than a little bit of confusion. We walk out our front doors every day and we are confused. So I would say that I'm not quite sure why we need this ordinance to begin with.
Ultimately, it's the board's decision. I think it would be helpful for staff. I would like to say that the ordinance is being enforced by the county. It's just that because of our situation, there's very few projects that would actually qualify for it because of the thresholds that they have to meet and how many development applications that we actually receive in our office that have an irrigation system as part of the landscaping. Most people have native vegetation, rely on rainfall in order to keep their landscaping healthy or alive. But I mean, if the board chooses not to put it into our ordinance, it makes no difference as far as our office enforcing it. We have to.
Right. Any other comments, questions? Yes.
I guess I have a question for council. What if we don't? I know we contemplated this in discussions over the last 6 months. What if we don't?
So kind of same answer as Ms. Kunstel. It is a little bit more confusing both for staff and for the public when we don't have these things codified. It is required to be enforced. Sometimes someone in the public who doesn't know that and is looking for to do Public Records Act requests or whatever, we might be hit by those a little bit more because they don't know if we enforce it or not because it's not in our code. And so we could become, a target for Public Record Act requests. And possibly any suits coming out of those things, even though we do enforce and have been enforcing. If it does, if the knowledge doesn't get passed from person to person, in CDD, on the website, if something happens, then it can become less clear to staff as well. And there's always the concern that in the future, because of those issues, that it wouldn't be enforced. And so that's why we kind of brought this forward at this time. I think, in general, I think a lot of us have, kind of the statute really isn't that applicable to our county because of our amount of rainfall and because we don't have projects that really fall in this category that much. So I understand why back when the board didn't want to take an action on it. But I do think the more appropriate action, instead of, kind of making it less transparent to the public and to the board, would probably be to lobby this issue or bring it forward as something that you don't want to exist in state law, because no matter what we do on the local level, the state has really taken the authority on this one, and so we don't have an option to not enforce it. So, if folks at Big Rock, other, agencies or whatever are not liking the state ordinance, which I think is really the case, probably more than not liking us adopting it, probably lobbying, their constituents or their elected officials at the state level would be the way to go with it.
Thank you. Yes, Heidi, you got something else?
I would just also like to add that this is part of the SB 1383. So I know that there's lobbying efforts that are going on regarding it. So perhaps, as Council Cable mentioned, it could be added to that discussion.
Right. Thank you. Yes, Supervisor Berkowitz.
This reminds me of the one-size-fits-all Big Brother ordinance that all come down by the state that affect Barstow and Bakersfield and certainly have nothing to do with us. Is it possible that we could take an action to ask State Senator McGuire to see if we could amend this law, because it certainly doesn't apply to us?
Well, I think if it doesn't apply to us, then nobody's going to be impacted. So I don't know why we would go through that. We're trying to help staff out in getting to a point where they don't have public records requests, that we don't have the threat of litigation, that we don't get into these other things by something that we're already doing and that we already have to do. And I don't know why we need to go down that road. It's like the state passing a speed limit law, and because they don't come up here and enforce it, we're not supposed to adhere to it. That doesn't make a lot of sense to me. So, it's something that's already been put in place. It's already something that we have to adhere to. If you want to contact the legislature and saying that this doesn't really apply to us, if we don't have any impacts, why are we concerned about it? That would be my question. So I would entertain a motion at this point, if there's no further discussion.
Well, just one more point, and if I recall correctly, the various agencies, both the city, the county, and the airport JPA, had been contacted in the past through folks that potentially wanted to litigate against those agencies for the presumption that we were not enforcing state laws. So I think this helps codify and clarify that fact.
Exactly. Thank
Right.
you. Is that a motion?
Yes, I'll make that
second
motion.
it.
I have a motion and a second. Now I will ask for any public comment if we have that capability. So for those of you that are on Zoom participating in this meeting, please remember to click the raise hand button if you would like to speak when comments are open to the public. Do we have anything down? Okay, seeing no public comment, then we'll bring it back to the board. Any further discussion? Kylie, would you please poll the vote?
Supervisor Berkowitz?
Yes.
Supervisor Gitlin?
No.
Supervisor Cowan?
Yes.
Supervisor Howard?
Yes.
Chair Hemmingson?
Yes. Okay, that discussion took a little longer than I thought, so we passed our public comment time period, so we're going to open that up for public comment now. Members of the public may address the board on matters which are within the jurisdiction of the board. If you are addressing the board regarding a matter listed on the agenda, you may be asked to hold your comments until the board takes up that matter. Is there any public comment For those participating in the meeting via Zoom, please remember to click the raise hand button if you would like to speak when comments are open to the public, which they are open to right now. Do we have anything, Dan?
Chair, I have a
No.
written public comment that was submitted
Okay, please.
from Burt Castle Branch, and it says, "The coronavirus is killing our business along with the shutdown of spring salmon. We have 37 RV sites that are not filled and we can't hang on anymore. We need some assistance immediately, and what business we have had there is no business now. Please give us some help."
Thank you. Any other public comment, Dan? Okay, seeing no other public comment, then I am going to close the public comment and move on to our next timed item, which is a 10:30 timed item. Conduct a public hearing to approve and authorize the submission of the 2019-2020 Community Development Block Grant application, and to approve and adopt a resolution of the Del Norte County Board of Supervisors approving an application for funding and the execution of a grant agreement and any amendment thereto from the state CDBG program as requested by the county administrative officer.
I believe Tony is on as a panelist. Good morning.
Good morning.
I'm going to go ahead and get started. The
Okay.
2019-2020 notice of funding availability is a result of the 2-year redesign by HUD and CDBG, which has been a collaboration between stakeholders as well. The goal of this redesign was to achieve alignment with the state CDBG program in California and with federal regulations that govern the program. It was also designed to increase local capacity to place and operate the programs and improve program communication and operations, and ultimately to ensure that activities are implemented and funds are expended in a timely manner. The 2 most significant changes, or 3 most significant changes, I apologize, in the redesign under this NOFA are the addition of an over-the-counter or OTC application process for all capital construction projects. The intent of this is to shorten the period between when a jurisdiction applies for project funding and when the funding is awarded. It will allow jurisdictions to apply for program funding when projects are ready for implementation or essentially shovel-ready, as opposed to a fixed competitive funding cycle. OTC means that the first complete and eligible applications received will be the first to be reviewed and awarded, provided that the application is complete and meets all of the program eligibility criteria. The second is the implementation of a new grants management system, which they're calling the Grants Network. The Grants Network will allow applicants to apply for CDBG funding online and will track the status of their application once submitted. This new system is going to be easier to navigate and does not require applicants to submit hard copies of the application to the department. And as previously submitted, our last application was over 600 pages. So that's going to be a benefit to all communities. The Grants Network will also support the programs and projects from the application through the actual implementation and closeout, and will connect with other digital accounting and reporting systems used by both the department and Housing and Urban Development. The last significant change is the 50% expenditure rule. The good news is that the rule now only applies to like programs. So for instance, public services, etc. Since we have not spent any of our 2018 public services award, we are unfortunately not eligible to apply under this current NOFA for public services. This NOFA is also unique in that it is a multi-year grant. So that means that over $60 million is available, $30 million for each year. As a part of the citizen participation requirement, a public hearing was held back in December of 2019 to solicit input in the project design phase of the 2019-2020 Community Development Grant from the public. Based on the projects brought forward, if authorized to proceed by you today, the county staff will develop an application that identifies the proposed project as recommended. Therefore, I request that the board approves and authorizes the submission of a 2019-2020 application and approves and adopts a resolution approving an application for funding and execution of a grant agreement to the state CDBG program for an economic development competitive grant for an agricultural tourism planning and feasibility study.
Thank-
If the grant application, if the application is approved, the project will be completed and funded related to the project. I apologize. It will be expended within a 36-month period beginning on the date of the standing agreement with the state of California. Costs relating to the grant activity will be reimbursed by the Department of Housing and Community Development. Are there any questions?
Thank you, Tony. Are there any questions from board members?
Tony, can you hear me okay? Can she hear me okay, Dan?
Are there any questions?
Yeah, I just wanted to know if she's hearing me okay. Tony, how are you doing? I appreciate your report on this. So what's at stake here is a $75,000 application for a grant that would have something to do with an economic study. Is that my understanding?
Correct.
Okay, so what do you foresee this? How will this translate into what kind of a report? And it's only 75,000 because there's no overlap. The rules have been changed from before. So how do you see this grant being utilized?
So the funding for this will be used to procure a consultant for the ultimate development of an agricultural planning and feasibility study. The study is needed in order to assist in the development of avenues in which the county can support businesses within these sectors.
Okay, I heard that. Thank you. Thank you, Tony.
Has anybody got anything else? I would entertain a motion.
Sorry. I make the motion to authorize the submission of the 2019-2020 Community Development Block Grant application and approve and adopt a resolution of the Del Norte County Board of Supervisors approving an application for funding and the execution of the grant agreement and any amendment thereto from the state Community Development Block Grant Program.
Second.
Thank you. I have a motion and a second, and I'm going to ask for public comment. For those participating in this meeting via Zoom, please remember to click the raise hand button if you'd like to speak. Seeing no raised hands, we are going to call for the vote. Kylie, would you poll it, please?
Supervisor Gitlin?
Yes.
Supervisor Berkowitz?
Yes.
Supervisor Cowan?
Yes.
Supervisor Howard?
Yes.
Chair Hemmingson?
Yes. Okay. Now we're going to, thanks, Tony. Now we're going to move on to our 10:35 timed item, which is a COVID-19 update by Dr. Warren Raywalt, Del Norte County Public Health Officer. Dr. Raywalt, are you there? Okay. Okay, we're going to put that on hold for the time being due to technical difficulties, and we're going to move on to another item. Can you let us know when he comes back up, Dan, or is he just going to come on? Okay, thanks. Okay, so we're going to move on to item number 11, which is to introduce by title only an ordinance repealing, updating, and enacting parking regulations, waive further reading, set a hearing date for April 14th, to adopt the ordinance and designate county council to prepare a summary. County council.
So I'm going to talk about the three at the same time, and then
Okay.
if there's specific questions about this one, then we can go through each of them. So the board had asked, with Supervisor Gitlin's lead, to move forward with a 72-hour ordinance for parking along roads, which we didn't have. And agreeing that that was a good idea, the board asked us to work on that ordinance. So we had actually been working on our parking ordinances for a while, just kind of revamping those. A lot of them hadn't been changed since 1957, so a lot were very out of date. And so we took some time to really kind of go through and revamp. That was done with the parking ordinances as well as parking regulations, although the revamp of parking regulations is very circumscribed by California law. So the enforcement really has to be pretty specific under the vehicle code. And so we did not do a lot there, just kind of double checking days and some of the procedure to make sure it's still lined up with current changes to the vehicle code. In all, one of the major things is that 72-hour ordinance that will allow, say, CHP or other enforcement agencies to tow after 72 hours. We kind of revamped some of the, we took out the location-specific areas, for example, Cooper, and we put all of those specific things into a resolution. Working with our engineering staff, Rosanna Bauer, who I believe is on the phone, hope she's on the phone for this one. We tried to put everything into the resolution so that that's more easily findable, and that when there becomes an issue in a particular area, that those things could be looked at more specifically in that particular area. So rather than laying these out specifically in the code anymore, those specific things are changed to the resolution so that the resolution can change more easily if there are specific roads or issues that people want to address. So that's a little bit of a change. Before it was kind of back and forth. The disabled parking remains the same, just kind of updated under the vehicle code. We are fairly limited in California under what we can do because the California Vehicle Code takes away a lot of the authority of the counties to do anything specific. But where we do have the ability to do some specific things, we have allowed the ability to do that, should we want to in the future. So the 72-hour, the trailers, trailer must be connected to a vehicle. If it's left there not connected, then that's not in compliance. It's unlawful to block a highway. Other than that, there's not really a lot of substantive changes. Most of it is kind of updating the code. So that's kind of this one. The enforcement, like I said, is we just went through the process and procedure and updated under the vehicle code. A waiver for indigent people and a definition of such was added since that was created after our code was in place in 2009 on the enforcement. So that's pretty much what I have. If you have specific questions, I can answer them. Some of the maybe more specific roadways, Rosanna Bauer in CDD can answer them if she's on the phone.
Okay, so council, so we have the regulations, the parking regulations for the first item, and then enforcement provisions for the second item, and penalties for the third item. Can I take these all at once? Can I take comment on these all at once? So if anybody has...
I think you can take comment on them all at once, but I think they need to be a separate motion for each one.
For each one.
And just an FYI for the resolution, so on ordinances, you have to have the two hearings, the introduction and then the adoption. Because we don't want to do one without the other, the resolution, even though we could adopt it today, I'm asking that you just review it, look at it, let me know that if you want changes put onto the next meeting. So that one will it'll track with the ordinances.
Okay, so no action on item number 13?
No, I think it's just review and put it on the next agenda.
Okay, good enough. Any questions?
Yeah,
Supervisor Gitlin?
Thank you very much, Mr. Chairman. Liz, this satisfies State Vehicle Code, I think it's 22615, the absent of paragraph K, which we're one of the few counties that doesn't have this. This conversation was driven by Commander Larry Deepy from the Highway Patrol when he brought this to our attention, that he provides a very necessary tool. I understand that we have to have these as separate ordinances rather than lumping them together in the case of 11 and 12. So I'll make that first ordinance a motion repealing, this is the parking regulation, to waive the further reading, set a hearing for April 14th, and adopt the ordinance, designate county council to prepare a summary of the ordinance for publication as requested by your office.
I have a motion,
Second.
and I have a second. Any public comment for those participating in the meeting via Zoom? Please remember to click your raise hand button if you would like to speak. Do we have any raised hands? Seeing no raised hands, then we'll bring it back to the board. Any further comments? Kylie, would you please poll the vote?
Supervisor Howard?
Yes.
Supervisor Cowan?
Yes.
Supervisor Berkowitz?
Yes.
Supervisor Gitlin?
Yes.
Chair Hemmingson?
Yes. Any word from Dr. Raywalt?
I believe he is on the line.
Okay. Dr. Raywalt, would you like to give your presentation now? Still not hearing anything.
He just texted and said he could come in person.
Okay. All right, that's good. So we'll move on then. Okay, so now we're going to move on to item number 12, which is to introduce by title only the ordinance repealing and updating the parking. This is enforcement provisions for the parking regulations as was stated before. So I would be looking for a motion.
So moved.
Second.
I have a motion and a second. Any public comment? And remember, for those participating in this meeting via Zoom, please remember to click your raise hand button if you want to speak. Do we have any speakers? No speakers. Bring it back to the board. Kylie, would you please poll the vote?
Supervisor Berkowitz?
Yes.
Supervisor Howard?
Yes.
Supervisor Gitlin?
Yes.
Supervisor Cowan?
Yes.
Chair Hemmingson?
Yes. And we have item number 13, which is to review, this is not an action item, review the updated resolution establishing various parking regulations and penalties. So we'll review this, bring it back to a meeting in the future. I'm assuming maybe the next meeting. Is there any public comment on that particular item? For those participating in the meeting via Zoom, please remember to click the raise hand button. Anything? Okay, seeing no public comment then, any comments from board members? Seeing none, we will move on. And Dr. Raywalt is headed down, I take it. Jay, do we have any legislative or budget?
Not at this time, no. Take a short break while he's here.
Okay, it's 10:54 right now. We're going to take a break until Dr. Raywalt shows up. We're hoping that will be in the next 5 to 10 minutes. So stand by. 1 o'clock, we're going to call this meeting back to order. Dr. Raywalt has joined us. Thank you for coming down. Sorry for the inconvenience.
No problem.
He has a presentation on the COVID-19 virus, and he's going to give us a briefing. Dr. Raywalt, please.
Thank you. I'm sorry about the delay. We were trying to do this from a distance as per the standard these days, but we ran into some trouble over at the office. Kimmy Scott prepared this PowerPoint presentation that you have on your screens, so I think we'll just start off with it. So go ahead, go to the next slide. Or do I have control of that? Okay. So these were the latest numbers as of early this morning. Kimmy is an early riser, so she was tabulating them. And I know that Supervisor Gitlin had some numbers that were actually higher. I heard that on the early part of the meeting this morning. So you can see how literally this changes hour to hour, minute to minute. Worldwide, well over 300,000, 190 countries affected. You can read those numbers for yourselves. It's growing exponentially. Next slide. So the governor's order is essentially the last layer of trying to establish the community mitigation strategy. We've been talking about this for over a month, talking about flu rules, of things people can do at home to protect themselves, social distancing. We're all doing it now, obviously. These are what the order takes effect on, mostly. Essential services such as gas stations, pharmacies, food, all those things are open. Closed to dine-in restaurants, bars, nightclubs, entertainment venues, gyms, fitness studios, public events. Anything that gathers people together in a way that it's easy for them to make mistakes and not follow social distancing has to be taken off the table.
Dr. Raywalt, do you want questions as we go along, as they come up in the presentation, or do you want to finish the presentation?
We can do it either way. It's a fairly short presentation. I'd be happy to take questions at the end if people can say them. But either way is fine with me.
Yeah. Well, I was just, while you were on the portion that what was open and what was closed, we were having a discussion on hotels and vacation rentals. Does that go into the part that's open or the part that's closed? I don't see it listed.
Hotels are essential for a lot of the essential workers. So when they're on the job and traveling to perform those jobs, they need a place to stay. So hotels are not taken, they're not on the closed list per se. Ideally, you'd be able to separate out that group of people staying at the hotel from people who are just traveling for leisure. But I don't think we've figured out a way to do that yet. I don't think anybody has. Vacation rentals, that's another kind of a questionable area because some people do use vacation rentals in today's market for the same purpose. So I don't have a clear guidance on that yet.
Okay.
And I'm not sure the state has one yet either.
Yep.
Are you looking into it? Because that's what.
Turn your mic on in case.
Are we looking further into it? Those were primarily my calls this weekend. Were constituents concerned about vacation rentals? It is spring break. People made plans before. We've heard that a lot of them have canceled, but there's still that aren't.
Yeah.
So I didn't know if it was something we are looking at. I hear you when you say that we do use them for traveling nurses and stuff. But is there any way, or are you guys looking at, kind of trying to kind of hold those back at all and trying not to bring too much into our community?
I'm not sure how we would be able to do that. It'd be difficult to enforce. I don't think we can deny travel outside of a general order from the governor to forbid travel. So I sense from what I've heard from other jurisdictions that enforcement of that, trying to separate those two things out is really tough. I think we're all still kind of waiting for some better guidance.
Right, thank you.
Thank you.
Doctor, what about businesses that have to be open? For example, Alexander Dairy, where they're milking cows every day. Are those open or closed?
They're open, because that's part of food production.
Okay.
So anything tied to essential services like food, pharmacy, stuff like that, or any of the supply points that support those services are still open.
Dr. Ringwald, I'm relying on your expertise medically, and I know you are speaking from that position of expertise, but there's an economic factor that, in fact, as was told to me, that some people believe the cure for this COVID-19 virus is actually worse than the actual virus itself. Businesses are shutting down, layoffs are ongoing. Who's going to pay for that? People are suffering. How do you address that economic factor, if at all? Or are you going to take the position that you're going to do what's best and an expertise as a medical official in terms of how we survive once this crisis, however long it lasts, will continue?
Well, the main part of what I do in the middle of a pandemic is try and align with higher authority. So if the governor issues an executive order, which he's done, our job at the local level is to implement it as much as we can. And I sympathize with the economic impact. I don't have a good answer to that. All I can do is tell you the possible outcome if we weren't doing these things. And that is really kind of horrendous. So I'll give you an example. If you think about what happened in Italy last week, we've been hearing all the reports about death rates around the world from this virus. 1%, 3%, 3.5%. In Italy, where this became a crisis, the death rate rose quite dramatically to about 10%, and it still could go higher. And that's the difference between having enough medical support to manage everybody at once and not. And they don't, and nobody does. We have maybe 1.5 hospital beds per 1,000 people in this county. It's probably less than that because the catchment area for Sutter Coast includes most of southern Curry County, all of Brookings. So we don't have in place anything to meet the demand if the virus gets out of control. And if you start to think of it that way, I've talked about the people who are likely going to do well versus the people who are likely not going to do well. 80% of the population are probably going to do fine. But that leaves 20% of the people who are going to get very sick with this. And if you don't have a hospital or if you don't have a medical system that's able to help them, a higher percentage of that 20% is going to die during an outbreak that's uncontrolled. So if you can do the math, say 10%. We have, 28,000 people in the county, roughly? 2,800. So for frame of reference, we get about 270 to 300 deaths per year in Del Norte County under ordinary circumstances. So in a scenario where we weren't doing anything, where we were just allowing the virus to take hold and burn its way through the community and do its thing, we would lose 10 times as many people. And that's kind of a conservative estimate. It could be worse. So that's the trade-off that people have to ask themselves. I sympathize with all the businesses that have to close. In fact, in the public service announcement yesterday, I told a true story. My in-laws are brewers and restaurant owners in Southern California, and they had to lay off their last workers last weekend. So, it hits close to home to me too. I know this. But as a medical professional, and knowing what we know about this virus and what the potential is, I can't advise anybody not to follow the governor's directives at this time. It has to stay in place. It's troubling that we don't know how long, and the economic impact is going to be huge, at least in the short term, and we all know that. But the trade-off is maybe losing 10% of the population of this county, and I don't think anybody would want to see that happen. I certainly don't.
No, I understand your concern and what you're saying to this, but talk to us about the recoveries. We have 27 deaths in the state to date, and it will no doubt go up. 2,100 cases, and that will no doubt go up. What about the recoveries in the state? We know about worldwide, over 103,000 have recovered from this coronavirus. Are we close to turning the corner on this?
No. We will turn the corner when we get enough people infected and recovered that we can develop what's called herd immunity. So that's the concept where you have enough people out there walking around who've been infected, they have immunity, they can't really catch the virus again, or they can't catch it in a significant way, that the virus has nowhere to go. So the few remaining people who are still infected, the virus gets sneezed or coughed out of them, but it lands on someone who's already been immune. So that herd immunity is what protects us in the end. And the best estimates are probably between 50 and 70% of any given population, any community, has to achieve that. They have to have gone through the virus, they've had to experience it, had to develop immunity, and then they are protecting the rest of the community just by having gone through that. That is a long process. That's a long process even if we did nothing and let the virus just go wild, it would still probably take 8 to 12 weeks. Because it just takes that long for the virus to replicate and jump from enough people and just exponentially grow, and then it would die off and it would be done. But we'd have a lot of people die in the process. If we slow it down and keep it to a crawl like we're doing, it drags it out even farther. But it makes it manageable. And it gives the medical community the best chance to save as many people as they can and get as many people better as they can. So it's a trade-off. And it's a tough, tough trade-off. Everybody knows that. All the policymakers at the federal and state level understand this very well, and we've seen what's happened to the economic markers already for the country. But if we don't do it, we could lose a lot of people, and lose a lot of people all of a sudden. And that's how serious this virus is. You know, I just can't stress it enough. There are too many people at risk unless the system is preserved to take that chance.
Just a final question, comment, because we are comparing this coronavirus with other past viruses, and I'm hearing very clearly the virulence level of this virus is exponentially quite a lot larger than the SARS or any of the other viruses we've been associated with over the years. Commonly manifests itself as a flu, where we do have 20, 40,000 people expire in the United States per year as a result of the flu. But this is, according to what I'm hearing, far more virulent.
More virulent in the sense that everybody is susceptible. So yes. It by itself is probably in the same category as SARS. The SARS virus was not as transmissible. At least that's what they concluded in the end after they did all the follow-up research about it. But this virus is transmissible enough that it outpaces things like the common flu. It's actually more transmissible. And that, coupled to the fact that everybody is susceptible, as far as we know, means that the death toll could be very, very high. Okay, I guess we can continue. So Kimmy put together some ideas for people to do while this is getting sorted out. She wants everyone to think that this is not a lockdown, that this is really just social distancing, just kind of preserve as much distance between everybody as you can. She gave some do's and don'ts, some family activities there that I thought were good, and especially the don't part. Don't congregate in groups. That's the big thing, and stay away from people. You have to treat yourself and everyone around you as though you're infected, and you should just kind of do that all the time, because that's how you develop the habit, and that's really what's going to pay off, because it's not going to be a quick thing. Next slide.
Chairman, question.
Yeah.
Doctor, if you could address the last slide specific to the dues. A lot of the board has been had discussion with the public through social media and other venues about a lot of that due list, specifically the beach and hiking trails around our area. And we've been essentially asked to shut those down. Can you help the board address the due list specifically in our region?
I think the purpose of including outdoors on the do list was to give people a healthy outlet, you know, just a chance to get outside and see that the world hasn't really changed that much, and also get some exercise, get some fresh air. I think if people practice the social distancing that we're talking about while they're doing it, it's fine. You know, I've seen a lot of those shots of the crowded beaches, and from a distance it looks like a crowd, but really what matters is, are they 3 feet away from each other, 2 feet away from each other, are they 10 feet away from each other on the beach? Are they paying attention and not going there when they're sick? That's the other thing. Nobody should be going outside anywhere around other people if they're sick. So I think it's almost essential that people have some outlet, some way of getting out of the house and doing it in a healthy way, as long as they're practicing what we're asking them to do about staying away from other people. I think it should be fine.
And that's, you know, a good point, but it's not on here. Don't go out if you're sick. You know, that needs to be said.
Yes. And we have
Over
said that a
and
lot, and
over
I'll say it
again.
over and over again. If you're sick, you should stay home. Don't presume that you know the difference between a cold and COVID-19, because most people are going to get this and not know that. They may get it and not know that they had it. We hope to find a way to track down everybody after the fact. And we've been thinking about this already, and that's very far off in the future. But we want to know when enough people have been infected and recovered that we can start to tell people, yeah, we think we've got some herd immunity in the community. And, you know, that's the time to start thinking about relaxing restrictions, whatever they may still be at that time.
But getting to that point, Dr. Ray, well, if you get a community like ours right now that's not infected, not that we don't expect it, I think at some point we're going to expect to have a case. But if we don't have a case, how do we get herd immunity if nobody's ever had a case?
We can't. That's a
There you
good
go.
point. For right now, we are waiting, and we're just doing as much preparation as we can. And part of it, the main thing that we've been doing is trying to prepare people, because this really literally is a community project. To make this work, people have to really believe that it's important, because it is important, and they have to actually put it into practice, because that's going to make the biggest difference. You've probably seen on the news that they were comparing outcomes in pandemic flu in 1918 and 1919. So they compared a couple of cities. I think they were Philadelphia and St. Louis. And one of them put all this into practice. I think it was Philadelphia. And they had a flat line of cases, just a trickle of cases going through. The other one did not, and they had a huge surge. And that's what they talk about, flattening the curve. They don't want that surge of cases happening all at once, because that's what overwhelms everything, and that's what causes people to die. It's that simple. If you can keep it into a slow crawl through the community, just slowly trickling through, case by case by case, and then the medical system, they're going to be working as hard as they've ever worked for months to come, and everybody knows that. But they'll be able to manage it. And that's our goal. That's what we're trying to do. We want to get as close to that and stay at that level as long as possible.
One more
Thank you.
question.
Yep.
So that kind of brings me back to the state, bringing out the National Guard on Friday, helping. I'm seeing the senator was talking about they're deploying, I don't know how you, bringing in more beds. There's not a need for us right now, but when that needs happens, I'd like to assure the community, because some of them are so convinced that we're just up here and forgotten. How do we assure our community that we won't be, and those things will be accessible to us as well as the larger areas?
Well, we're definitely dialed into the system. So it is, you step up what you need, you step up your requests as you need them, and then the system will help meet those requests if they can.
Do you feel the state has been assisting in fulfilling our requests to this point?
Yes, and I'll tell you why. Because I was health officer I started health officer the first time right before 9/11. And so I remember the SARS outbreak, which was only a few years later. And I know that what was going on then to communicate and manage the system was far less well developed than it is now. So the state as a response agency has a lot of capacity. What they don't have right now is a lot of resources, because the resources don't exist. We need more PPE, we need more ventilators, we need more oxygen concentrators, we need the basic medical stuff to get the job done and actually take care of people. And it's still being developed. There's not enough on reserve to be shared, and the new pipelines have not been developed yet. That's one of the reasons that putting everything on this kind of shutdown mode is vitally important, because that gives time for that development to take place. And then we'll be in a better position to manage whatever comes down the road. But as far as requests go, Kimmy would be the better person to ask, but I know from watching the email traffic and requests and responses, it's very quick. The system is far better developed to do this than it was. It's just that it's resource poor at the moment.
Thank you.
Please continue.
So speaking of the system, the Emergency Operations Center, that's a good segue into this. It's in a virtual environment. It's a level 2, which is a medium level. The priorities and the critical issues, established communication with lifeline agencies and organizations, that's pretty much been done, and we're just continuing it. We're working on housing and feeding and medication needs of vulnerable public. There's a lot of issues that are continually going on as part of this. We're trying to build a volunteer workforce. In fact, we put out a message yesterday asking for medical professionals that are new retirees in the community that we may not know about to help us. Any kind of volunteer activity is going to be appreciated because there's a lot of work that could be done down the road. The main thing that we're working on now that we've kind of gotten the message out and people understand this and it's under the imposition of governor's orders, is we're taking the next stage, which is helping with medical surge, trying to back up the medical system as much as we can. Next slide. So these are the lifelines. This is Kimmy's summary. I think it's very good. Safety and security, food, water, shelter, health and medical, energy, communications, transportation, hazardous materials. A lot of the stuff that still needs to happen to keep the community going are still working. So we're still getting food deliveries. We're still getting fuel deliveries. We aren't cut off from anybody. It's not like a tsunami event where we could be literally on our own for weeks. So that is good. The big one on that list is health and medical. And that's the big one on everybody's list. There's just no getting around it. Because the health system is not designed to deal with a situation like this. It just is not there. A few comments on testing. Within Del Norte County, we've been trying to discourage unnecessary testing. I think it's been pretty successful. I've put out bulletins to the healthcare providers several times now asking them to strategize their testing. The testing capacity is still pretty limited. It is slowly growing, but the demand is kind of outstripping the growth of the capacity. There is some good news on the horizon. We think there will be availability of a rapid test within the next few weeks locally through a company called Cepheid. It's a diagnostic test that is much, much shorter, and it can actually be done here in the county. We don't have to send it out, which will be nice. That'll start to change our game plan a little bit because it'll allow us to get some more testing out into the system, more on a surveillance basis. If we had testing like they had in South Korea, we'd be doing it left and right, up and down, as much as we could, just to pick up those first cases as they come into our county, because that helps us immensely. We don't have that capacity here.
So do you think it's going to be a couple of weeks, 2 to 3 weeks?
I've been told about 2 weeks.
What's the time frame now when we send a test off? How long does it take us to get results back, roughly?
If you send it to Quest or LabCorp, we've seen turnarounds between 5 and 9 days.
Wow.
They're just swamped.
Yeah.
I mean, California's a big state, and
Sure.
they're just swamped. Humboldt Lab has a little different algorithm for getting the test. We're a little more involved, and we track it a little more closely because it's a public health laboratory. That turnaround time is usually 2, sometimes 3 days, depending on if it shows up on a weekend or not. And they're also swamped, by the
Have
way.
we got tests out now? I mean, have we received all the test results back that we've sent out?
We have 5 outstanding tests yet that we're still waiting. And the rest have all been back, and they're negative. I think it's about 35 tests total now. And for a county our size, that's actually pretty good. So I think we have a rational strategy. We're trying to deal with some other respiratory pathogens right now because it's cold and flu season. And we know that there's a couple things going through the community that mimic this a lot. So I know the doctors at the hospital and other clinics, they've been coping with this a lot. So we're doing okay. All of us just wish we had more testing capacity.
Yeah, Chris.
Chairman. I would love you to stay on that topic and maybe dive a little deeper into it, because I know a lot of us are getting notes that people want to donate money to increase our capacity for testing. And if you could emphasize that that capacity just isn't there, so it's clear. I suspect we'll still get the questions today, but we want folks to be very clear that there is nothing that we can buy at this point.
It's not a money issue. It's just a resource that hasn't been developed enough to meet the demand. And obviously because the demand is everywhere all at once. So I think they will catch up, especially with these new testing strategies. Cepheid's not the only company that's doing this. There's going to be others hitting the market very soon. I think a month from now, when I come in here and talk to you again, it's going to be a very different story. So, okay. We're asking for volunteers. I mentioned that before, especially the medical volunteers. We have a lot of tasks that we've identified and some more that are on the horizon that could be done by people who are at risk and still have medical training. A lot of our volunteers are in the high risk category. You know, the highest risk category is over 70. The governor said over 65. The data shows that the real tipping point starts at about age 50 and really takes off after 70 in terms of just age as a risk for a bad outcome. So we know that a lot of our volunteers are retirees, and so we don't want them to take unnecessary chances. So we're trying to ask them to participate, and we're going to try and keep them safe. And that's the place to call if you're interested in volunteering. We'd love to have young volunteers because they're going to do well with this, and they don't have very much to fear. The problem with young volunteers is until we have a better testing scheme, we may not know if they're infected when they volunteer. So we want to take names and numbers. We're waiting for a better time to call them in.
We've got a whole bunch of kids out of school.
I know that.
Very
That'd
antsy.
be great.
I have one at home.
Sign them up. And then a couple of things for everybody to remember. It really is something we're all in together. It's viruses cross borders, they cross economic, there's no boundaries to them at all. And it's a marathon, not a sprint. No matter what happens with the economy, what decisions are made about lessening or tightening restrictions, this is going to take a long time, because it's a virus that's worked its way into the human population around the world. It's got to work its way through. It's probably going to stay with us for a while. Someday down the road, maybe in 10 years, it's going to be a common cold virus like it's supposed to be. But right now, it's a serious virus because it's a killer. The rules apply to everybody. We want everybody to maintain some hope because this will end. All outbreaks have a beginning and they all have an end. It's not forever. And the last thing I mentioned, I wanted to make sure that you understand that your leadership as a group is very important on this. And I'm sure you're aware of that. And I'm sure people calling in are telling you that, but it's vitally important. So stay the course.
Right on. Appreciate that. Thank you. If we could open it up for public comment, and we probably won't answer any questions as you make them, but we'll try to make notes, and if it's something Dr. Ray Walt can answer, maybe we'll have him hang around for just a few minutes and see if he can answer those questions. And remember, if you're participating with Zoom, via Zoom, please remember to click the raise hand button if you'd like to speak. And we'll open that up now for you to speak if you want to raise your hands, if you have any comments. Okay, no comments, Dr. Roy Walt. Are there any other questions from board members at this time? Okay.
Thank you.
Thank you very much. I appreciate you coming down. Sorry for the mix or the technical difficulties. Okay. Kylie, did we get everything?
Yes.
Okay. And with that, thank you very much for participating. Hopefully this will get easier, or we'll get more used to it and things will go a little smoother. Thank you all for participating. We are adjourned.